Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Claudine Holt. She is an occupational medicine physician and life coach. Today's Kevin MD article is Nervous System Dysregulation versus Stress, Why Just Relaxing Doesn't Work. Claudine, welcome to the show.
Thank you so much for having me, Dr. Kevin.
All right, so let's start by briefly sharing your story and then why you decided to write this particular article on Kevin MD.
Yeah, so my name is Claudine, and I did OBGYN residency for 2 years before switching into occupational medicine and then lifestyle medicine. And I think, like so many other physicians, I've been, burned out earlier in my career. I experienced that, and then discovered, coaching, which was life-changing for me. And, after becoming coach, like so many people, I decided to become a coach. And that was just kind of like a snowball. So became certified in life coaching and then eventually in integrative somatic trauma and then in more somatic techniques like EMDR and finally in polyvagal theory or polyvagal therapy through the Polyvagal Institute. And so what I have come to experience and also in the work that I've done with my clients is that our nervous system really is so important for our experience and how we show up in life, but also how we experience life as well. And so for me, the nervous system is really like the operating system. That's usually how I describe it and explain it. And having a knowledge about how our nervous system impacts our daily experience and understanding what state you're in, it really plays a huge role. And then now I also have a medical practice where I help women with their hormones and their nervous systems because I realize that it's actually the two of these systems really working sort of in a partnership together. And so that was really what led me to want to write this article because a lot of physicians, we have the information about the nervous system. We all learned about it in medical school, right? We all did anatomy and we know about the nerves and how they traverse through the body. But really having an understanding of that sort of more day-to-day application of how the nervous system shows up, I think that's incredibly important. And so I wanted to really share that.
All right. So we're going to talk more about your Kevin MD article about that. And as you know, and on this channel, a lot of physicians are burned out, undergoing a lot of stress. So how does the nervous system play a role in that?
Yeah, and so, of course, we all lived through the pandemic, and that really brought the conversation about, burnout and stress to the forefront, not only for us as clinicians and other healthcare workers, but just everyone in general. I think everyone was thinking about mental health and, their well-being. And
Mhm.
so a lot of that information that we tend to receive about, how to deal with burnout or stress, it always focuses on self-care
Yep.
and about getting the massage or taking your PTO or making sure that you're meditating or praying or practicing mindfulness, and all of those are wonderful practices, but sometimes they can almost be like a band-aid, like
Mm.
putting a band-aid on top of what's going on underneath. And so the nervous system is really that what's going on underneath. It's again the operating system. Your nervous system state impacts how you are seeing the world, whether it's a safe space, whether it's a dangerous space, whether people are safe to engage with or not, and ultimately how you feel showing up or not in your life. And so a lot of people have, information about, thoughts, feelings, and actions and sort of that cognitive triad, but really it's the nervous system that plays a big part in even how your thoughts are coming up and how you're seeing the world. And then that impacts how you feel and whether or not you take action. And so it's very important for us as clinicians to understand this. Like, for example, if your patients aren't taking your advice or they're not taking their medications, it's very easy to write them off as so they're just not cooperating
Yeah.
with the plan, right? But that might not be it. It might be that they have some underlying trauma or they've got other issues that are impacting their ability to show up and to take your advice, or maybe they have other stressors that are weighing more heavily and their nervous system is in survival mode. And so for them, they're, taking their blood pressure pill or thinking about renal disease, 10 years down the line is not at the forefront of their mind. It's maybe
Mhm.
paying their mortgage or, you know, making sure their child comes home at night. You know what I'm saying? And so it's important for us to not only understand the nervous system personally, but to also see how other people are showing up in their lives because of their nervous system dysregulation.
So, in your article, you talk about understanding the language of the nervous system, and sometimes that
Mhm.
can help us better interpret some of the situations that the patients come to us for. So, tell us some of this verbiage and that helps us understand the context of why patients come in for what they do in the context of nervous system dysregulation.
Yeah, so this work, I do want to credit Dr. Stephen Porges. He is the one who first posited this polyvagal theory, I think in the 90s. And I just really highly respect, his work. And he really helps us to see that the nervous system is really made up of different states. There's
Hmm.
6 nervous system states altogether. Most of us simplified into 3. So most people know the terms fight, flight, freeze, and fawn. And really, those are states of dysregulation based on what's happening in the body. So, in the sympathetic system, the parasympathetic nervous system, and then there's actually 2 branches of the parasympathetic, there's the dorsal and the ventral.
Hmm.
And so, from the 3 main states, there's actually 3 blended states as well. So, there could be a mix of parasympathetic and sympathetic both on board at the same time. And depending on what percentage of each that you have, if you want to look at it that way, you get these blended states. So it's important to understand that each nervous system state makes complete sense based on whatever is going on in your life at a particular time. I think a lot of people just maybe turn in on themselves, or they judge themselves, or have this inner critical voice. Why can't I be more like this? Or why can't I do this? I really want to do that, but I'm doing the opposite thing
Hmm.
that I want to do. It all makes sense when either patients or coaching clients are telling me what's going on in their life. I can immediately see what nervous system state that they're in, and it makes perfect sense. Your nervous system ultimately is designed for one mission, and that's keeping you safe. And so anything that it perceives as unsafe, whether it's an actual danger like that bear chasing you in the woods,
Hmm.
or it's that you got that email from your boss with no context that said, I need to talk to you now for a meeting, and your brain just starts creating what that could mean, right? And so just understanding that every response, every reaction that you have at the level of the nervous system makes sense. And once you can identify what state you're in, then you know what to do from that point. Then you can sort of get yourself back to a place of regulation.
So, talking to a lot of physicians who were in similar situations like you were, perhaps burned out and stress, how can understanding how their nervous system is dysregulated lead them out of that state of burnout? Give us an example.
Yeah, so just in general, understanding what nervous system state you're in just again brings more context to what's happening. So instead of the default, which is maybe to blame yourself or to say I'm not a good enough doctor, or I'm not a good enough mom or wife or daughter, whatever it is, it helps you to understand that no, your nervous system is just responding to the
Mm.
circumstances that are happening in your life, and there's a reason why you're showing up the way that you are. So I it definitely helps to reduce any maybe sense of shame or maybe stigma that you might feel about maybe how you're reacting in a certain situation. But just literally understanding that your nervous system can be regulated, that you can go from a state of dysregulation to a state of regulation with very actually it doesn't take a lot. Even just a few minutes of regulating can have a profound impact on your heart rate, your HRV, your blood pressure, your sense of well-being. And of course, we know that there's other consequences that come from not being regulated. You're more prone to inflammatory states, you're more prone to emotional and mental disturbances, you're more prone to getting, sicker or having more of a
Hmm.
weakened immune system, right? And so just having that understanding of what the nervous system is, what state you're in, how to regulate it, and how to, and I think it's very important to say this, is no one lives in a state of regulation 100% of the time. So it's not about staying in ventral, which is what we call the state of regulation. No one lives in ventral,
Hmm.
but the skill is really recognizing when you're out of ventral and then getting back into ventral again and again and again. And it becomes more of a practice. So all of those wonderful practices like meditating or maybe prayer or going to church or whatever it is that is nice and helpful for you, getting that massage, going to Pilates, whatever it is for you. all of those things, when we develop those habits, it helps to get us back into ventral again and again and again. And we start to expand our capacity for what we can tolerate. So instead of having a very narrow window of tolerance where the smallest thing will just get us dysregulated, we expand that window.
Mm.
So it takes a little bit more for us to get out of that state of regulation.
Now, what kind of advice do you have for physicians to get back into that state of regulation? Is it meditation? You mentioned prayer. What are some easy ways they can do it? Obviously, they can talk to a coach like yourself, but absent of that, what are some things that they can do?
Yeah, so those are great things. Everyone should have what I call their like regulation list. So identifying those things that you know make you feel good in the moment, right? So it could be something very, very small that just closing your eyes for a few minutes. There are lots of different nervous system tools and techniques. There are apps that have different
Hmm.
techniques and tools that you can use to regulate your nervous system. And they can be very simple things. Breath work is a very simple
Yeah.
one. Box breathing,
Yep.
4-6 breathing, where the exhale is longer than the inhale. There are several techniques out there that even have, evidence in the literature that show that these things do increase our capacity, improve our heart rate variability, which is a marker of nervous system regulation. And so there's just a wide variety of tools. What I usually encourage people to do is to build their own toolbox.
Yep.
So figure out those maybe 5 to 10 tools that you can deploy in the moment. Maybe if you have an office, you shut your door and you just, do whatever that tool is that works for you in the moment and get back into a state of regulation. And it's very important to understand when you are dysregulated, you actually don't have access to the prefrontal cortex, right? That higher thinking part of our brain. So that's the part of our brain responsible for problem
Hmm.
solving, for, creativity, for wanting to connect with other people, right? When you're dysregulated, you immediately get out of that state and it's kind of like it's me against the world,
Hmm.
right? I got to
Hmm.
protect myself. So that's not the state that you want to be in if you are in practice, if you're taking care of people, or if you're a wife or a mom or whatever, right? So it always helps to try to recognize when you're dysregulated, get yourself back into regulation, and then go on to have those, conversations or those interactions with people.
Now, is there a diagnostic test to show whether a nervous system is dysregulated, or is it just a purely clinical symptoms?
It's primarily clinical. There are some, things like you can measure your HRV. So a lot of people have maybe Aura rings or HRV sensors. The Heart Math Institute, they also have devices that you can get to track your HRV. There's, other types of biofeedback that you can do to look at your nervous system state. But HRV is the main one that people will look at as a marker for your resilience or your nervous system regulation. And so, but the thing is, you can just track it based on how you feel.
Hmm.
We all have access to our emotions, but we also have access to symptoms and signs in our body, right? When we get angry, when we're in a state of sympathetic, we get irritated, frustrated. We know what that feels like, right? Our heart rate goes up. Maybe that adrenaline is pumping. We get really, shaky or whatever it is, right? And we also know how it feels to be in a state of dorsal. So that's when you're all the way shut down, that you're cold, you're numb, you're clammy.
Hmm.
Maybe you just are very listless, right? So it doesn't take much to just what we call introception is just kind of turning your focus inward and just noticing what are those, symptoms, what are those emotions, what are those thoughts even that are coming up when you're in different states of dysregulation, and then noticing how you feel when you're in an opposite state, when you're more regulated.
And HRV is heart rate variability biofeedback. For those who aren't familiar with that, talk to us more about how that's measured and what are some of the findings out of normal mean in terms of dysregulation.
Yeah, so there's going to be a spectrum of HRV for different people. There are tables out there that give you sort of normative values. What I tell clients who I have a breathwork program that I created that's actually all about trying to improve your HRV through breathwork. What I tell my clients is it's more important to look at the baseline where you start and then where you end up than whether or not you're in the normative,
Hmm.
for a particular, age or gender type. But the most important thing is just understanding that HRV is measuring that beat to beat variability between your heartbeats. And it's really what's happening in that window that can tell us a lot about how well your body and your nervous system is able to respond
Hmm.
to the challenges of life. So you can measure that. There's several ways. Some cameras on your phone, there's apps that actually just use the phone on the back of your the camera on the back of your
Hmm.
phone. There's also, I have HRV sensors that are clipped, you can clip to your ears. Those are pretty inexpensive. The Heart Math Institute, they also have more expensive devices that you can get if you're really interested in that. And your typical, smartwatch, Oura Ring can also give you information about your HRV. And again, it's not so much that you necessarily need to shoot for whatever that standard is for your age and gender, but looking for the improvement over time as you start to regulate
Hmm.
your nervous system.
Now, I'm a primary care physician. How can understanding nervous system dysregulation help me in the exam room when I'm talking to patients? You mentioned a few scenarios earlier in our conversation where the genesis of what they come up with could be nervous system dysregulation. Give me an example of how understanding that can help patients.
Yeah, so I think it just understanding your own nervous system allows you to have a lot more grace and compassion for
Mhm.
other people because you understand that we're all just humans and we're all just doing the best that we can. I really do believe that. Yes, there are some bad people out there, but I think in general, we're all just kind of responding to our upbringing and some of the earlier experiences that we had in life. We know about ACEs, we know about all those things, right? That contribute to how someone is showing up in their current life, the things that they experience in their childhood, these adverse childhood experiences. And so understanding the nervous system can help us to have, again, more compassion, more grace for people, understanding that the patient who's in front of you, who's not taking your advice, is not necessarily just dismissing you or just trying to ignore your advice, but again, there may be something else that's
Mhm.
going on. So once you can sort of recognize the signs of dysregulation in yourself, you'll start to be able to recognize them in other people. And I know we're all strapped. If you're in a traditional, insurance-based model, maybe you don't have more than 15 minutes with a person. But even just being able to notice, hey, it looks like you're looking a little, shut down, or you're
Mhm.
not really making eye contact, or you look a little agitated. Can you just what's going on? And sometimes just asking the question allows the person to feel safe enough to share their what's going on in their life. And again, the nervous system is all about safety. So if you feel like a safe space to a patient as a clinician, they may feel safe to share and to open up more with you as well. So becoming a safe space for yourself, but also a safe space for your patients is huge.
We're talking to Claudine Holt, occupational medicine physician and life coach. Today's Kevin MD article is Nervous System Dysregulation versus Stress, Why Just Relaxing Doesn't Work. Claudine, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think the most important lesson maybe that I would impart is that understanding that the quality of care that you can give to your patients is really going to be dependent on the quality of life that you give to yourself. So those things can't really be separated. So if you are constantly stressed, if you are, burned out, if you are, hating your work, hating your life, it's going to be very hard for you to give quality care because of what I said earlier,
Hmm.
right? When you're in a state of dysregulation, your priority is just surviving at that point. Your priority isn't the patient who's in front of you or your spouse or your child or whatever. And so it's really important to understand, especially as doctors who are sort of wired to give and give and give and to sort of put ourselves last, is that we really do need to understand that we can't be the best at what we do if we don't take care of ourselves first. And so nervous system regulation is going to be a core pillar of that, making sure that your gas tank is full, so
Hmm.
to speak, so that you can give the best quality care that you can to your patients.
Claudine, thank you so much for sharing your perspective and insight. Thanks again for coming on the
Thank
show.
you. Thank you for having me.